Patients frequently have questions about the risks involved with in vitro fertilization. The most common things that can happen with IVF are uncommon, but they include infection, bleeding, during or after an egg retrieval, because it does involve a minor surgical procedure where a needle is inserted through the vaginal wall into the ovary. Women are given IV antibiotics at the time of the egg retrieval to reduce the risk of infection. Commonly, there is some bleeding from the ovary after an egg retrieval. We see this, we observe it, and watch to make sure that it is stopping. Rarely, the bleeding will continue beyond what is a small amount, and the patient will have to be observed. And very rarely, 1 in about 500 or 1,000 times, a woman will need a laparoscopy or a surgery to stop or control the bleeding. The other most common complication is ovarian hyperstimulation syndrome. About 80% of women will develop mild ovarian hyperstimulation, which involves some bloating, increase in size of the uterus, and some tenderness in the ovaries after the egg retrieval. This is extremely common, expected, and you will be provided with pain medications to manage these symptoms in the days following the egg retrieval. A small percentage of women will have what's called moderate ovarian hyperstimulation, which may require IV fluids following your laboratory values and sometimes some medication to decrease the risks. Very rare problems that occur are severe ovarian hyperstimulation, which is like 1 in 1,000, which results in a hospitalization, blood clots, or life-threatening complications. We work very hard to decrease these risks and minimize the chances that anything serious would happen during the process.